Good evening and welcome to the Namibian's very own Heartbeat Show. My name is Charmaine Gashihe and I'll be your host for tonight. Today we're talking about mental health and the different types of mental health illnesses, a topic that is usually hard to talk about or joked about a lot because many lack understanding. In certain cultures, talking about mental health is regarded as a taboo. In studio, we are joined by Dr. Lahija Hamunjela, a psychiatrist and an addiction prevention professional. She will give us insight into what mental health is. Doctor, thank you very much for joining us.
Good evening, and thank you very much for inviting us.
Thank you. Just to get right to it, we would like to know, what is mental health?
Okay. When we talk about mental health, we are talking about the well-being of a person. So when we talk about the well-being, then we mean now the emotions. Why is somebody experiencing a certain emotions towards something that happens to them? And we are talking about the behavior that comes with that. And why are you having that certain behavior? And we are saying that even though you are experiencing stress every day, you are supposed to can be able to cope in a daily life with all this stress. But when it becomes now a problem that it actually disinhibits or causes a problem in your daily living, then it becomes a mental disorder.
When it becomes a mental disorder, do we then regard that as depression, anxiety, or maybe you could perhaps also delve into what are the different types of mental health illnesses out there?
Okay. You know, that's why I think today's topic is very important, because of the way you introduced it. For some people, when you're talking about mental health, the only thing that they know of is depression. We divide mental illnesses in you can divide it like from psychotic, being that the person hears and think, or you can then say mood disorders, then therefore we are looking at the person can be depressed or overly happy than they normally are. Or we can look at sexual dysfunction. We can look at sexual dysfunction, it's also a problem. We can look at disorders that happens or occurs during childhood, which we call neurodevelopmental. Then it's only your children you look at. Then you can look at substance addiction. Unfortunately, it's only mental health that is dealing with it, so it falls under mental health. Then we have other disorders that are caused because you are having another illness, which we call which can be a general medical condition. Therefore, because you are having that, then you also come to have a problem with mental disorders. Mm-hmm. And apart from that, then we have also what we call old age disorders that happens when the person is getting older. So you also then can present for the first time in old age with a mental illness.
Under psychotic, doctor, can you perhaps delve into that? What falls under psychotic disorders, and maybe then how are these people treated with regards to that?
Okay. When we say psychotic, we mean that obviously this will include all the five senses, né? So that it can mean either they are hearing voices. These voices can command them to do something to themselves or to the other person, or these voices are just in the background talking amongst themselves. Secondly, apart from hearing voices, then this person can be seeing these people as they are talking to them, but the other person is not able to see this person. The other one is like they can feel things that are abnormal, which we call tactile hallucinations. These are just hallucinations that you can feel like insects are crawling under your skin or something. Otherwise, it can be through the taste. They taste something different even though they don't have anything in their mouth. Or they can eat the food that you cooked, but then they say it tastes like something else. Or it can be a sense of smelling. They can smell things that other people cannot smell. Okay? Mm-hmm. So we have all those things. Or then they also have, sometimes they have a false fixed belief. It can be towards somebody, it can be towards something, but they believe that that is reality. For them, it is actually reality because that is what they believe. So the onus now lies with you as a psychiatrist or as a therapist to challenge this false belief. Then we'll see that the symptoms are more severe, moderate to severe. Then we are saying, okay, well, then we put you on antidepressant and you continue with psychotherapy.
Mm-hmm.
And the side effects, yes, there are some side effects. Certain medicine have side effects, but we always educate a person about the side effects. And it is also not that everybody will have the side effects of that certain medication. It works within an individual. So one person, this type might work, then other one, the other type might work. But we work accordingly to the patient and the symptoms.
Mm-hmm. So then, can one overcome mental disorder, or is it recurring? As you alluded to earlier on, you said people might have episodes, the first episode, second episode. Will it be recurring, or can you overcome? Can you get better? Can you get healed from whatever disorder you may be going through?
Okay. When we are looking at mental disorders, we are looking at 3 factors. Okay? 3 factors, meaning that it can be biological, which means it can be genetic, or it can be psychosocial. You look at those 2 things. Psychologically, what is happening with the person in the environment in which they live? What is happening? What are the current stressors? What made the event to happen? So we need to look at those things, you know. So if it is genetic, we are saying, yes, you are predisposed. So, meaning by the time you have a stressor, then it is what is now perpetuating the illness. But given that all the other factors are steady or stable, the person can overcome. It doesn't, mental illness is not curable, like, for example, other things. We are saying that we can control it and you can remain symptom-free if you are on your treatment.
Does this go the same for people who've been diagnosed with anxiety? I understand it's also another form of mental illness. Can they have stresses, and can it be recurring as well?
Yeah, anxiety is a mental disorder. Mm-hmm. And therefore, if you're talking about anxiety, we will ask you, okay, is it, you have to assess yourself. Is it when I'm going to talk in public? That is a specific anxiety. Is it when I have to go to the mall? Or is it when I have to go in high places, or aeroplane, elevator, things like that? All those are anxieties. So therefore we say in that case, most of the time you are going to work with the psychotherapist, because then they will train you and teach you how to overcome, you know, that anxiety or stressor, and learn how to anticipate it. If you have, if that, you know, okay, going to the mall is what stresses me, then we'll look at it.
And we'll look at it. Doctor, I want to focus also on depression, because there's this notion going around that, especially for the millennials and maybe I think Generation Z, that there's this phrase where people say we are a sad generation with happy pictures. This is one of those things where people make it seem like we must be posting happy pictures, pictures of when we are sad, like sort of like forgetting that depression is a mood, like as you alluded to, it's a mood disorder. So 1 minute I can be happy and post my pictures, the next minute I'll be sad, I'll be depressed, and I can't post that. What would you say to this phrase specifically?
To the depression. Now, when we are talking about that, for me, it looks like if 1 minute you are happy, the next minute you are sad. That can be that it's a bipolar. So bipolar then disorder means that you fluctuate between happy and sadness. So, and it can fluctuate within days and hours. So the day that the person is happy, they do everything in excessive, you know, and they can go on spending sprees, money that they don't even have, buying things that they don't need. Then the next moment you see them, they're down. Yeah? And in that down time is a time that they don't even get out of bed. So they don't even want to post a picture of themselves, or even thinking that there's any happiness in their lives. So what do we need to do? We say we need to talk about depression. What is it? Normalize the topic, normalize the fact of going to seek help while it is early, you know, as opposed to when the person is really down, too depressed. Because on the one hand, when they're depressed, we are also saying that it's possible for them also to commit suicide. It's possible for them to also hear voices. And at the end of the day, when they have attempted or they commit suicide, is when one then becomes remorseful, that I actually missed some of the symptoms and signs that the person was giving. So we have to make it a normal topic to discuss. If you are depressed, it's okay. Then go see somebody or take tablets. It's okay.
Yeah, but how can then families tell whether someone is not okay or mentally unstable at the point? And then perhaps how can they best deal with this? Because sometimes you would have a friend or a family member say, you know what, I'm tired of living and I will commit suicide. And then sort of like say it in a joke, or perhaps they are drunk. How do I then address that and deal with it and be sympathetic towards this person as a family member or as a friend?
That is a very good question. Everybody who commits or who attempts has verbalized it in one way or another. The problem comes from the person who's receiving it. You don't know whether to take it serious or the person is joking. It is better to take every threat that they make very serious. For the fact that they verbalize it to you, it means they trust you. So then it's for you to ask, what do you mean by that? You know, are you feeling like ending your life right now? How severe is it? And if the person is going on, then you say, yes, there are available resources, you know, like for the government, we have the mental health. That is where we go. You take the person there. If it is after hours, obviously you go to Katutura emergency, they will be screened, and then they will call the psychologist on call or the doctor on call for that. Then they will see the person. But we're saying talk about it. Honestly, talk about it. Sometimes they prepare. They even gives you hints, you know, like writing wills. People who never had wills, they are writing wills. They are handing out the most important belongings. You have to inquire what is going on, you know, and why is this person hopeless? Why?
That is quite interesting. Writing a will, I've heard of that. What other causes of mental illnesses do we have? I know, for instance, past traumatic experiences, especially for younger people. But what other things can cause mental illnesses, especially for someone who is much older? You spoke about older people, when they get a certain age, then they start experiencing mental illnesses or mental issues. Okay.
Like if you remember in the beginning, I said we look at it in three ways, yeah? Biological, psychological, and social.
Yes.
Now, if you look at an old age person, it's like, remember, a lot of events have taken place in this person's life. Now comes at a certain time that, for example, they had a spouse. The spouse is no more. They have to deal with that. They had children. All the children have left the house. So loneliness, obviously. When they're alone, what kicks in? Depression kicks in. And also the brain itself. The brain is aging. So it's shrinking. Certain functions that they used to do, the body used to do, it's not going to be there. And then obviously voices, as you are losing the sight and the hearing, that also comes with problems of that. We are saying even depression at that age, even schizophrenia, it's there, even bipolar at the age, that later age is there. And especially if the person has been predisposed genetically, and also substance. We also have to take cognizance of substance. Is this person using substance? Was this person using any substance? Were they medicating themselves when they start? A lot of people start their substances because they are self-medicating. They don't want to hear what they are hearing, or they don't want to feel the way they are feeling.
So then, basically, let's say substance abuse should be out of the question if I'm experiencing mental health issues, or I'm not okay at the time.
Okay, we are saying that for you to have a primary psychiatric diagnosis means that we have to be 100% sure that you are not taking substances, okay? But at the same time, we are also not saying that a person who's taking substance cannot have a co-occurring psychiatric disorder. It can be both. However, if the person takes substance, it makes your mental illness come up quicker and faster, né? And your prognosis is very poor. But in a person who doesn't take any substances, we're saying your prognosis is very good, because for one, there's no substances, and then once only one look at this, the primary problem, and you medicate the person is adherent, you know, they become okay, as compared to the one who has a substance. Now, substance itself can mimic a mental disorder. Depending, are you taking now cannabis, are you taking cocaine, are you taking opioids, what are you taking? One of those can mimic also.
Oh, okay, now I understand.
Yes.
Since you've been practicing for a while, what are the experiences you've had with your like the patients you've had walk in, and in terms of mental health? How is it on a daily basis?
Mental health, for one, on a daily basis, we're saying, like, if we look at our setting at mental health, it's like on Mondays and Wednesdays are supposed to be our outpatient days. And on a normal day, we see almost more than 100 and something patients. That is walk-in patients. On other days are supposed to be now inpatient days. Then on those same days, you are seeing the ones that are inpatients. You also have those that are walking in. Which kind of disorder do we see? We have seen everything. From depression, from schizophrenia, from pedophilia. You know, pedophilia is also falling under mental illness. Sexual dysfunctions, everything. Bipolar, we have seen all of these. And you can't just look at a person and say, this one is having schizophrenia, this one is having depression or bipolar. You would really need to be sitting with this person to see and hear, because some of it is just the thought disorder. So the person will be talking and they think they are talking some things that make sense, but when you are listening to it, you're like, but what you're saying is not making sense at all.
Doctor, I want to delve more on pedophilia. It's a very controversial topic. We've had this discussion with my friends, with my colleagues. Why is it regarded as a mental illness? Maybe you could explain to a lot of people who do not understand. And perhaps if you've had such cases, do you then, and the person has committed that act, do you then report it to the police?
There's a difference between legality and ethics and professionalism. As a treating doctor, my obligation is towards the patient. If the patient is sick, I will speak for the patient and the mental illness. Now, when it comes to pedophilia, it is very controversial. You know, you as an individual, what is your belief? And you as a doctor, what are you bound to do? This person is mental. They don't have an understanding of the fact that I'm actually sleeping with a minor. They get their satisfaction through sleeping with a minor. But we are saying that if you have to look at with a legal definition, then you have to look at what does the law say. From which age is one able to make a decision as to be active, you know, like to take consent. As a 14-year-old can't give consent. So it's all these things. So we are allowed, you are allowed to report it, but then now the law then has to take its course.
Only then after the person has been treated? Or how will it work? Do they get on medication for this? Or do they get counseling first? Okay.
So by itself, without an underlying cause, there's no need for a person to have medication. The only thing is therapy that works with that. And obviously we are saying then they have to face the consequences of what comes from the law. We can only offer the therapy, but then after that we can't say, is this person guilty or not guilty? The law has to be.
Yes, to take its course.
Yes.
I also want to talk about the stigma surrounding mental health. A lot of people do not want to speak about mental health because it's stigmatized so much that if, like what we spoke about earlier in terms of if someone wants to commit suicide or they make the joke about committing suicide, they say it's a joke because there's so much stigma around it. If someone tells their friends they are depressed, or if someone moves to book themselves into an institution, it's sort of frowned upon. What can you say to the stigma around this?
Unfortunately, that is reality what we are living in. People have stigmatized mental health so much that the stigma itself prevents the patient from going for help. A family would rather accept that their person has high blood or diabetes as opposed to depression or schizophrenia. But we are saying that in every family, you just have to accept what was given to you. You know, we are saying that this family can have then cancer, this other family has diabetes, this family has mental illness. But it can also mean that even if they have mental illness, there is a certain time and point in their life that they are functional. It's not that you're born with it and you live throughout your life with that. Sometimes you can have the episode, sometimes you can't have the episode. What we need to do about stigma is we need to inform the nation about mental illness. You know, there's that speciality of mental illness. Talk about it. By withholding things, we are actually exposing the person to even to become more depressed. And talk about people making jokes about it. If, for example, a child has lost a parent through suicide, you know, sometimes we don't even attend the funerals because you're like, the person committed suicide. That is what they deserve. Now imagine what the child is gonna go through mourning the parent, when they bury the parent, and when they become adult. What are they going to go through that? So by the time they feel depressed, they will not even expose it because they know what they have gone through with the loss of that one parent. So we are saying if the person committed suicide, talk about it. You know, think about the ones that are left behind, because for the most part we don't think about these people that are left behind. They are also suffering, and there is always help out there for those, even for the survivors.
What would your assessment be on, we've read stories of 8-year-olds, 10-year-olds committing suicide. How best then can parents avoid such instances? Because clearly this child has been depressed for a while, or they've been bullied or going through something. How best can parents, you know, address that and just talk to their children to prevent this? Okay.
You mentioned a very important thing, which is bullying. At schools, a lot of children are being bullied, but they don't talk about it when they come home. Or when they come home, we actually push it under the carpet, and then, or we dismiss this child. So we are saying that allow the child to express what they have gone through. Ask, how was your day? How, any friends, anything happened, which is very unlikely, you know. And then when they start talking, or you notice from the results, school results, it goes down. That's a sign of something is going with the child. Let's talk about your results. What is happening? You know? And then you talk about it, you know, in as much as research shows that from teenage, but even younger ones, younger than teenage, it happens. So get to know your child and open up with the child.
Then, so basically speaking to our children about these things, or our children basically coming to us feeling comfortable enough. But do you think parents can also contribute to the child's traumatic experiences? I mean, I've seen people in my generation grow up, and past trauma affects them on a daily basis, I guess, because they've never had that, you know.
Trauma plays a very big role in what the person will go through or how they respond to it. So the way we parent our children is also molding the child in how they react to stress and anything in their future. So as parents, we are saying if we are fighting too much in front of the children, it's either they normalize this or they withhold to express how that affects them. But other aspects of life, it will show that this child is definitely having a stressor somewhere. Or you can even look at, you know, somebody would have attained what we call dryness, not peeing in the bed, you know. They had reached that milestone. Now, because they're experiencing a stressful event, this person starts to bedwet again. So that should also be a clue for a parent. Why is my child bedwetting or even defecating, you know, in their clothes when they had reached that stadium? Yes.
Doctor, some of our viewers online, they basically speaking about, because mental health is one of those topics that has really, it's a very serious topic, but we don't speak a lot about it, and I don't think, you spoke about creating awareness and so forth. So people just want to know, in terms of the government, they're calling for government to invest more in mental health. What is your view on that? Do you think that there's a lot of investments coming from the side of government in creating the awareness and also just helping our patients?
I would say no. There's not a lot of effort coming in, you know, and we are saying that we are really always appealing to the government and the nation as a whole, you know, to invest in mental health and the well-being of our people. So, for example, if we say, how many psychiatrists are we in Namibia? You will be like shocked to know, for the population that we are less than 10. So imagine now, less than those 10 people, how many patients can I see in a day? And the assessment for mental health, the first one, takes almost 45 minutes to an hour. So that means it's one person. But the follow-up can be 30 to 45 minutes. Now, only 10 of us, that means like some of us are then doing both. We belong to the state and we belong to private. And we are saying we don't have somebody else we're expecting to come back within the next 4 years, except for one person who might then come back within 2 years. Then that means it's probably in the end it will be 11, but that's still not enough for the nation.
So we need more investment.
We need more investment. Even if you ask, okay guys, when is the Mental Health Awareness Day? They will look at you like, what do you mean? Is there something like that? Yes, there is. But do we have to wait for that Mental Health Day, the 10th of October, for us then to raise awareness? No, we have to do it every day, because every day is a battle. And especially now, if you look in this time frame that we are, and you look at the number of depressions we are treating, you know, then you are raising your eyebrows to say, what are we doing towards our population? If the 10 of us are not there, then what are you going to import? And that will even cost more for the country, to pay people who are coming outside the country.
All right. Another viewer would like to know, in terms of family members who have either someone who has committed suicide, or who is either committed suicide, or who is suffering from a mental illness, how can awareness be created for this family, or how can this family be assisted as well and helped, or do they also need counseling? Because it's a very traumatic experience to go through. Definitely
they will need counseling. Now, in our community, we have a lot of social workers, and they are very, very much available. So they are the ones that can always also go into the homes of somebody. You know, if you call them, then yes, they will go and assess the situation, and then refer the person to the mental health. You know, sometimes we say, okay, the person doesn't have a medical aid, so private they cannot afford, but mental health is free. In Namibia, it is free. You come there, we see the person, and then But the important thing, like I said, like if they have somebody who committed suicide, that is definitely a traumatic event for this person, and they need therapy. And it is okay for us to normalize to say, I have a therapist, I have a psychologist, and I have a psychiatrist, and it's fine. At least then you can survive that traumatic event.
And it won't also help in terms of, because I've seen people who have lost family members, especially from suicide, they blame themselves. I could have done something. I could have maybe spoken to her. I could have maybe, you know, would you advise someone who's in that place and space to seek help at the time? Or should, because they're blaming themselves for the loss, would you advise them to go seek help? Would you advise them to not blame themselves? Or what message would you give to them?
It is not easy to say don't blame yourself. That person is already in that position, at that stage of self-blaming. So they have to go through all the stages of grieving. So therefore, my advice would then be you yourself get help, so that you move out of that corner of self-blaming. Because if you don't move out of it, the chances are that you will also end up committing suicide, because some of these things we are saying they are genetic. So if you are observing this, then rather opt for therapy, and then somebody will help you to cope, how to cope with the loss of your loved one, and then for you how to go on with your life normally without blaming yourself.
Doctor, I want to go back to the part where you spoke about it's genetic. How do I know it's genetic? How do I know it runs in my family? Or how do I know we have certain family members who've gone through this? And can I go through tests to know exactly whether I have this gene?
Now, unfortunately, psychiatry, and I'm saying unfortunately, psychiatry is not run based on a CT scan, blood level of yours, how is it? A CT scan can only help to say something. But then we are saying we are only dealing with your mind and your behavior and your emotions. That is what it's causing. Genetically, yes, it can skip certain generations. You might have it, but then when you go back, you ask them, somebody in the family, the behavior, how was it?
Before we close off as well, Doctor, I would like to know, there's this notion, and I think a lot of us have heard it, in terms of when you have a family member, especially what you refer to as psychotic, someone seeing things, speaking to themselves. We've heard people say, oh, that's a madman, or people say, no, we are bewitched. What can you say to that? And while you're also are responding to that, you can also just close off as well.
Thank you for letting me close off with that specific one.
Please.
One, we do not call our patients mad at all, because I would rather then have to deal with the person who is calling you mad, because that means there's something wrong with you who's calling the person mad. Secondly, this person has a mental disorder. They are sick, so they are not aware of the reality of what is happening to them, you know. So it is the onus of you as the family or the other people to then say, let us get you to this place for medication, and let us not stigmatize people because of that mental illness. Let us normalize it. And the taboo against mental illnesses, bewitching, you know, that will be another topic. But what we are saying is, like, for a person who has a mental illness, the best and the only solution, get the person to the hospital, let them get the medication, and get your person to a better functioning level, and rather have your person present than being absent.
Thank you very much, Dr. Hamunjela, for joining us in studio today. Thank you to the viewers. Welcome. This is the first series of mental health. We'll have more of this. Thank you very much, and have a pleasant evening.
Thank you.